more deaths were reported yesterday in the Concho Valley from COVID-related illness. The city health department stated a man in his 40s and a woman in her 60s died. Both were unvaccinated. After Labor Day weekend, officials are bracing for a spike in coronavirus cases.
Yeah, numbers don't do it. I mean, each one of those numbers represents a person, and each one of those persons have somebody that loves them. I mean, this disease is way worse than the numbers, and unfortunately, we're just keeping score by the people that live or die. We're not looking at the effect on the community.
There's a stigma that can come from getting COVID-19, and people, or at least early on in the pandemic, didn't want to be identified at all because it was some sort of a sign that you did something wrong.
Honest. We tell it like it is. A handshake is where it is. You don't need a piece of paper. If you tell me something, we shake hands, I believe that. And if I tell you something and we shake hands, you can go to the bank with it. That's our motto.
Yeah, with the COVID stuff, first they tried to shut us down a little bit, but they figured out that we ain't gonna be shut down, so we're gonna live our lives.
We're going through a pandemic, but it's not the end of the world. God is with us.
Asking that everyone use social distancing, so you may not sit next to each other. You must have 6 feet apart, please. It is now 3 p.m. on March the 19th, 2020. We will call this meeting to order. We are meeting today to ask for our city council to make some tough decisions as it relates to the health and safety of our community.
You're the one on the local level that has to stand up there and say, well, Governor Abbott made us do that. I don't want to be thrown under the bus by somebody else, but I also don't like being thrown under the bus by a governor who, when we're the ones here who stand before on a daily basis, interact with the citizens of this city.
It wasn't immediately.
No, it wasn't. In fact, it looked like we were going to escape it for quite a while, although, we knew we wouldn't.
We made a commitment to the public that the minute we had a positive case of COVID-19 that we would call a press conference so that the citizens understood that we want to make sure they understand what's going on and that there's no secrets out there in terms of what's happening in this community.
By then we'd already been saying, oh, well, our plan worked, and of course our plan didn't work, and nobody's plan worked. Nobody anywhere was ready for this.
I wrote my very first article about COVID-19 on February 26th. And it was, what if? What if COVID-19 comes to San Angelo? What would that look like? What would happen? Are our local leaders prepared? Are our health officials prepared? And the general consensus was that they were cautiously optimistic. And so one of the officials that I spoke to who worked in our city's emergency department said that we're not a high traffic area. It's probably not going to happen. We're cautiously optimistic. There's a low chance of it happening, but that chance isn't zero. And today, we're seeing cases by the hundreds.
Dr. Varetis is over here. He might want to offer a few words and certainly have an opportunity to ask him some questions.
I'm residency trained and board certified in emergency medicine. I did a critical care fellowship for our critical care medicine, board certified in EMS or emergency medical services. I'm board eligible in disaster medicine. I've been through a master's program at Queen Mary University in trauma science. I just got accepted to a master's program at Queen Mary for tactical medicine. Right now I'm medical director for San Angelo PD, Tom Green County, Reagan County, Sterling County, Concho County. I'm the physician on Texas Ranger Special Operations Group, SRT-4. I'm going to be the medical director for the Texas Attorney General's office. So I do a lot of tactical medicine.
Anything change with respect to golf courses?
Well, what happened yesterday is Dr. Varetis and I, we were starting to get these positive cases in kids. And so Daniel and the mayor and Dr. Varetis and I had a conversation about how can we manage that short term. And so he issued an order that closed all recreational facilities. Part of that included golf courses.
I've had times where local leaders will tell me in private that we need to do something, whether it's a new order or some action needs to be taken, but they don't want to be the one taking that action. It's not that they throw me under the bus because they let me go to the transit authority and pick out the bus I'm going to be under, at least. They don't like the answers that they get. They know the answers are the right answers, but they all need to be elected, so they need to be seen reflecting the perceived values of the community.
All of us in some way, I think, did get thrown under the bus, not intentionally, and I say that not intentionally, but when you're in a leadership position, you have to know that sooner or later, somehow, some way, someone's going to throw you under the bus. And perhaps, you know what? Some people think we threw them under the bus. So it works both ways. That night, I think, was a great community coming together to say to the folks, not only the hospital workers, but people in the hospital, we love you, we care for you, we're thinking about you, we celebrate you. And that was a good message.
The community did rally. We wanted to cheer on, well, people in our community wanted to cheer on the doctors and the nurses and the nurse assistants and all the hospital employees that were having to deal with this.
But at the same time, my phone was blowing up with how dare you let these people get together, because they're not in their cars, they are walking around, they're sitting on top of their cars, and the cars are not that far apart, etc. So the same moment you're celebrating and trying to support the healthcare workers, you're getting these phone calls and videos from people who said, how dare you let that happen? How dare you? We live in a society where my late husband used to say, if you stood on the corner of Fluente's at 12 o'clock noon on a Friday and handed out $100 bills, there would be those people who said, well, why did you do it on Friday? Monday's the day I would go to Fuente's. Why did you give out $100 bills? Why didn't you do it at 2 o'clock? That's when I usually go to lunch. And so you realize today that whatever decision you make, you hope you get 50% support for that decision. We are so split as a society on every issue.
Cases during that time, on April 4th of 2020, cases in San Angelo were about 20. We had a total of 20 positive cases. 2 weeks later, on April 18th, our positive cases had doubled, more than doubled. We were at 41 positive cases.
I've had several friends admitted to the hospital with COVID. I have friends and acquaintances that are in ICU, intubated, on ventilators, who have been in there for weeks that I don't think are going to survive. And up till 2 years ago, they would come to me and say, hey, Jim, what do you think about this? And I'd say, do this, and they'd do that. But somehow, over the last 2 years, they got to the point that they think what they find on social media is more important or more truthful than what I tell them.
You know, I can remember one patient, a very unique experience. I've seen her every 3 or 4 months for 9 years. You know, she would always ask, how are those babies? And she wanted to see pictures of my boys. And so you build these strong relationships with patients. And you know, her daughter called us and said she had been diagnosed with COVID. And so we gave all the precautions and things to do and what she had to do and when to go to the ER and so forth, and she passed away that night. So we see this over and over again, and it's very impactful.
There's a saying in medicine that, you're only as good as your last case. And so if you do really great for 43 years and you have one disaster, you're remembered by that disaster. Right now my disaster is letting this happen to my city, to my communities. I think, again, people are just tired of seeing me. I'm tired of seeing me.
Hey everyone, Cody Broadway here. Thank you so much for taking the time to check out the NBCLX YouTube channel. Be sure to click here for more videos and also click here to subscribe to join the NBCLX community.